Hello, my name is Hongming Wong. I'm a job market candidate from Hitotsubashi University. I'll be presenting my job market paper, Parental Responses to Social Insurance for Children, Evidence from CHIP. When we think about children's insurance programs, we often think about the many benefits the insurance confer on children over the life course. But to realize these benefits, the program relies on the behavior of parents to enroll and to invest in the child. These investments can in turn impact the effectiveness of the program. However, parental behavior, in particular how they respond to children's insurance, has been under study in the literature on children's insurance programs. My paper provides empirical evidence on parental responses exploring the rollout of children's insurance. Focusing on the rollout allows me to isolate parental responses from program investments in the child. I therefore examine whether the information of insurance could increase parental investments and what are the implications for parents, children, or the program. My policy setting is the Children's Health Insurance Program rolled out across the U.S. states between 1997 and 2000. The program expanded insurance for children, raising the income limit for public insurance from 120% of federal poverty level to 200% federal poverty level. The expansion basically allowed twice as many low-income children to gain eligibility for insurance. However, because CHIP did not expand insurance for pregnant mothers, it is unlikely to impact the birth outcome of children. Nonetheless, birth outcomes may improve if pregnant mothers exposed to the rollout invested more in the fetus. I therefore examine birth weight and the in utero investments to understand how parents respond to children's insurance programs. My empirical strategy exploits the rollout as an exogenous shock on mothers' exposure to children's insurance. I measure exposure using the average income limit mother is exposed to in pregnancy. In this setting, the exposure is simply a weighted average of income limits before and after CHIP, where the weights are the share of pregnancy exposed to each limit. So by construction, the exposure will be larger in states with higher income limits, a more generous program, but also going to be higher within states for mothers gaining earlier exposure and hence longer duration of exposure to the higher CHIP income limit. In the regression analysis, I'll be including fixed effects, so I'll be using the within-state variation across cohorts in the exposure timing to estimate the investment responses. And I'm going to scale by the income limits to get at the dose response across different exposure levels to children's insurance. I first estimate the effect on birth weight, consistent with the differences in eligibility. CHIP exposure significantly increased birth weight for children single mothers, but not for children married mothers. The coefficient for the main effect of exposure is indistinguishable from zero. And absorbing the main effect using the full set of state year multi-fixed effects also gives me very similar estimates for children single mothers. So the effect is pretty much fully concentrated among children single mothers, and we basically find the same pattern for low birth weight. And the effect on birth weight suggests that pregnant mothers may have responded to the exposure by increasing private investments. To detect these investments, I look at mother's timing of care onset, number of visits, and smoking in pregnancy. Like before, I find that these investments are completely driven by single mothers, and in particular, the exposure reduced late care onset past the first trimester by about 7%. But despite this increase in early onset, there is not much of a significant increase in the number of visits by the end of pregnancy. And in column 6, we find a significant reduction in daily smoking at higher exposure in utero. So to understand the mechanism of the investments, I look at survey responses from SIP, Survey of Income and Program Participation. I can rule out mother's own insurance coverage, income, and health spending pregnancy as mechanisms. I also do not find an increase in mother's expected education for the child, which is inconsistent with an investment response that is driven by the long-run impacts on the child's education. Instead, the investments are consistent with the behavioral effect of CHIP exposure, lowering the present bias of mothers. This could happen if the exposure shifted mothers into temporal ways towards future utility and away from immediate investment costs, so making mothers more tolerable of immediate investments in the child. This behavioral effect would then predict less delay of doctor visits and less smoking in pregnancy. So to take this mechanism to data, I developed a dynamic model of investments where mother chooses resistant smoking each trimester to invest in the child's birth weight. And the investment obviously depends on how mother value the child's birth weight and her intertemporal preferences regarding investing early versus late in utero. I'm going to model present bias using the beta delta representation, where for simplicity, we're going to assume that our long-run quarterly discounting factor is equal to 1, and then going to let the short-term patient's term beta to vary by chip exposure. So I use the exposure as the preference shock on mother's present bias. In particular, starting from baseline preference, I can use the slope parameter to determine what is the implied present bias for a mother with a given exposure to chip. So essentially, I'll be matching investments across these different exposure levels to pin down these two parameters just to make the behavior effect on present bias. So what I find is that although chip exposure significantly increased mother's costly investments in the child, the benefit on birth weight is also substantial. On net, the exposure increased mother's utility by about 70% of the program spending, which is comparable to how low-income adults in the literature will value their own insurance programs. But different from own insurance expansions, the exposure to children's insurance increased mother utility because, well, that exposure reduced mother's present bias and increased her investments in the child. And the resulting benefit on birth weight increased mother's utility as effectively as basically expanding insurance for her own coverage. In the long run, there's also follow-up benefits in terms of the child's education and eventually reduce the social cost of insurance. I find from the census data that cohorts exposed to the rollout have higher college enrollment rates concentrated among children and single mothers. And this effect on education in turn is going to predict the life cycle earning gain that results in a life cycle tax payment increase by about $208. This amount is about 8.4% of the initial program investments in children. Therefore, there's substantial fiscal externality from parental responses to the rollout that eventually lower the social cost of insurance. So to conclude, the rollout of CHIP suggests that information of insurance can effectively increase parental investments by reducing the behavioral biases of parents. And these investments in turn also increase parents' own utility because they highly value the benefit and child outcomes. And this high valuation allows the exposure of the information nudge to be highly effective, comparable to expansions of their own insurance. And in the long run, there's going to be social benefits working through the child's education that lower the social cost of insurance. So these private and social benefits provide strong motivations for outreach efforts engaging parents in children's insurance programs.